Hello and welcome to another episode of the Health Notebook. Today's episode is a little bit different compared to previous episodes. We will be discussing work-related illnesses, which is a very unique area of medicine. However, before we proceed to that particular area of medicine, and just to give the viewers some highlights on how we actually diagnose a work-related illness, I'd just like to recap about the previous episodes that we've had on the show during the course of the year. So just to put you into perspective, all these videos are available via the Deen TV YouTube channel. So you're more than welcome to actually log on to the internet, go to YouTube and actually pull out your favorite episode. So going back to the very first episode in March during this year, we had Dr. Gopal discussing ischemic heart disease and stents. We had Dr. Cupido discussing palliative care. This was end-of-life care. We had Dr. Bangani discussing high blood pressure. We've had him recently discussing diabetes mellitus. So these were just the introductory topics that we actually had during the initial season of the Health Notebook. So if you need any information about these particular topics, as I said, you can go to the YouTube channel of Deen TV, and you're more than welcome to actually watch it and actually gain some information so that it empowers you, the viewer, to take control of your health. Going on further from episode 8 to 9, we looked at some psychiatric medical conditions. For example, we were speaking about depression, and we spoke to Dr. Hansrod about this medical condition known as depression. We had Dr. Willele discussing 2 or 3 topics about we had Dr. Willele discussing 2 pediatric topics, which was respiratory tract infections and immunizations. And then recently we've also had on the show Dr. Arendse discussing renal failure and some indications for dialysis. As we move on with these episodes, we will tend to broaden the scope, and we will be looking at various other topics as well, just to enlighten the viewers, which is you, the public, about various medical conditions and also the approach to these medical conditions. So when you actually go to the GP, you will actually have a very good interaction with your general practitioner as well. So going on to today's topic, we're looking at work-related health illnesses. There are very few registered medical specialists that has the qualification in terms of being a occupational medicine specialist. So we will be looking at this unique concept. It's fairly new, where we try to relate the work to your current medical condition. So normally when one would actually go to a medical practitioner, he would ask you the history. You'll come to a diagnosis, be it back pain or arm pain, or you might even come to a diagnosis relating to something pertaining to your skin. But sometimes it's also important to go a little bit deeper and try to identify the cause of this medical condition that you have. So these are actually the risk factors. I'm not saying every illness is related to work, but there are certain factors within your work environment that can actually lead to a medical illness. So the concept here, as I mentioned, is work-related health issues or work-related illnesses. And just to give you some examples, you can develop work-related hearing loss, you can develop work-related respiratory conditions, and what I actually mean when I say work-related respiratory conditions, there are certain elements within your work environment, and if you're exposed to these elements over a certain threshold, and if you actually breathe it in, It can actually cause various respiratory conditions. We've spoken a little bit about asbestosis, and what I actually mean by asbestosis, it's a unique respiratory lung condition where if you're exposed to these particular fibers within your work environment, and if you breathe these fibers in, it can you can actually develop a medical condition within your lung that is known as asbestosis. It's related to the fiber, and this particular fiber can also cause other illnesses as well. So that is just to put you into perspective. You are the worker or the employee. You've got all these hazards around you within your work environment, and if you're exposed to them in a very high quantity, this can actually affect your health. As I mentioned, we've had a small discussion on work-related hearing loss. So what this actually means is if you're exposed to excessive amounts of noise, and if you're not wearing hearing protection, it can actually affect your hearing, and you can end up being deaf, and you need to be able to and being deaf actually affects your quality of life as well. So we have work-related health illnesses. The example that I've mentioned was firstly is hearing loss. Other examples would be work-related respiratory conditions. You can also get work-related skin conditions. And what I mean by work-related skin conditions is if you're working in a certain environment where you're exposed to certain chemicals, and if you're not wearing gloves, and if these chemicals actually come into contact with your skin, you can develop various dermatological conditions, and this is known as a dermatitis. So when we're speaking about these dermatological conditions, you're actually exposed to certain chemicals within your work environment, and if you are not wearing personal protective equipment, and what I actually mean about personal protective equipment, this is actually the gloves that your employer needs to provide you. So if you decide not to wear your gloves and decide to actually work within your work environment without any personal protective equipment, the elements within your work can affect your health. So it's very important to actually adhere to your employer in terms of personal protective equipment. So some of those chemicals might not only affect your skin. If you breathe those chemicals in, it can also affect your lungs. As I mentioned, asbestos, which is a fiber, but these chemicals can also cause a condition known as work-related asthma. So work-related asthma, you would present with similar symptoms as normal asthma. However, these symptoms actually develop during the course of your employment. So that would mean is the chemicals, then you breathe it in, there's either a sensitization, and then you develop those same symptoms of normal asthma. So for us as a medical practitioner, we actually need to try to establish the work-relatedness. So this would mean that we need to look for the causal link. So after taking your history, after examining you, we might even ask you a little bit about your occupation. What time do you start work? Is the symptoms worse when you finish work, or is the symptoms worse when you're actually working? So that is the approach that we actually use, or one of the approaches. We tend to establish the work-relatedness in terms of the medical condition. And just to put you into perspective in terms of other medical conditions, so I've highlighted to you the importance of wearing hearing protection to prevent hearing loss, work-related hearing loss. I've also highlighted the importance of wearing gloves to prevent dermatological conditions, and also wearing mask as well if you are working with certain types of chemicals to prevent work-related lung conditions, example asthma. Then there is also the concept of work-related musculoskeletal musculoskeletal conditions, and this is actually divided into upper limb and lower limb musculoskeletal conditions, and this is just a broad term covering various subcategories of medical illnesses related to your muscles. So these are work-related illnesses or work-related musculoskeletal conditions as a result of your work environment. Just to give you an example as well, you could be an office worker and you're sitting in front of a computer all the time, you're utilizing a mouse, and you have a poor working habit, meaning that you don't take adequate breaks. You constantly staring at the screen, you're leaning forward at the computer, and this actually puts a lot of stress and strain on your body. So you have repetitive movements on the mouse, you're leaning forward, it's putting strain on your back as well, and you can actually present with back pain. You can present with a medical condition known as carpal tunnel syndrome if you're utilizing your mouse incorrectly. So those are the factors within your work environment that if you don't manage them correctly, it can predispose you to various medical conditions. So when the medical practitioner sees you, then again it's trying to establish that work-relatedness to your medical condition, so that they can assist you in trying to resolve some of those issues, but not only in terms of medication, but also making workplace adjustments. And what I mean by workplace adjustments is, as I said, if you're an office worker, if you've got the incorrect chair, or if you're leaning forward, if you're not taking breaks, it means that they need to correct, the chair. They need to educate you in terms of your seating position, in terms of the amount of time that you spend in front of the screen by having a 5-minute break after every 30 minutes. And this is actually there to prevent you from developing these work-related musculoskeletal conditions. So it's not only confined to the office worker in front of a computer screen, but it's also work-related musculoskeletal conditions can also affect the employer or the employee in a normal factory. For example, if you're doing repetitive motions, meaning you're pushing items, or if you're twisting and grinding on a continuous basis, if you're picking up heavy boxes, if there's no assisted work, or if there's no lifting or an assisted lifting device. So all these elements within your work environment, if they're not managed correctly, they can actually cause work-related medical conditions. So that actually highlights the work-related medical condition. Going a little bit further into that topic, so one would ask, how would you know that you have a work-related musculoskeletal condition? As I said, it can present in various formats. For example, depending on the type of work, depending on your interaction with the work. For some people, it might be a condition known as carpal tunnel syndrome. If you're using your wrist a lot, there might be compression of a nerve which is known as the median nerve, and you can develop pain and tingling within your hand and your palm as well. So that is just one of the medical conditions that falls under the umbrella of work-related musculoskeletal conditions. If you're using your arm and you're doing a repetitive if you're doing repetitive movements, it can affect your elbow as well. If you're leaning forward, it can develop in terms of back pain as well. If you're constantly leaning forward when you're engaging with your work without having a break, not only does it affect your hand and your elbow, it can also affect your neck as well. So you can develop work-related neck conditions if you're constantly leaning forward with your neck as well. And that can present with, as I said, it's a variety of symptoms. You just need to try to establish the work-relatedness. Does it become worse while I'm at work? Does it disappear once I leave work? Does it improve over the weekend as well? Does this pain, or is there loss of is there loss of sensation, be it on your hand or be it on your forearm? Is there loss of sensation, pain? Is there there might be some numbness as well, pins and needles. So if you can establish that work-relatedness, does it keep me awake at night as well? Does the pain keep me awake at night? So it's trying to establish the work-relatedness in terms of your symptoms. Now, one would actually ask, okay, how do we actually manage work-related musculoskeletal conditions? It's important to actually inform your employer about it as well. So after seeing the medical practitioner and after he confirms that this is possibly a work-related musculoskeletal condition, there needs to be a communication with your employer so that he can actually assist you in taking corrective actions. So this might be redesigning your workstation for you. Yeah, so this might be redesigning your workstation for you. It might mean that they have to elevate your computer screen, or they might need to get you a different type of mouse to prevent your medical condition from progressing. So it's the work adjustments. If you're a factory worker and if you develop a skin condition, then this also needs to be notified as well, as I said, but it's also making those adjustments by providing you the correct personal protective equipment. They might even need to place you temporarily into another area just to see how you're coping in terms of your work-related medical illness. So those are some of the management aspects. So what I've discussed is the non-medical management. Then there would be the medical management, which is then divided into the conservative treatment. Depending on your diagnosis, if we take the work-related musculoskeletal conditions, the conservative management would be sending you to a physiotherapist, sending you to an occupational therapist to assist you. If you've got the carpal tunnel syndrome, they might need to provide you with a splint. If you have other medical conditions, the physio might have to do some stretching. They might have to strengthen certain muscles. That is actually the multi-professional team. The medical practitioner will also provide you with medication. However, if your musculoskeletal condition progresses to such an extent, we might need to send you to an orthopedic who is a specialist that deals with musculoskeletal conditions, and they might have to then continue with the conservative treatment, or they might need to provide you with some type of surgery, but that is long term. So we normally divide the management into short term, medium term and long term, and based on your working conditions, there is this combined management plan where there is also a continuous follow-up to see how your medical condition is improving. So that is the engagement in terms of assisting an employee like yourself. That is the engagement in terms of a occupational medical specialist that actually will make contact with your employer. They work with a multi-professional team in trying to assist you to improve your medical condition. So they look at your work environment. As I said, you need to be exposed to these factors in excessive quantities or prolonged time. It also depends on you, the employee, if you're wearing your mask, as I said, or if you're wearing your gloves, or if you're working, or if you have bad workstation habits, as I said, sitting forward or utilizing your mouse incorrectly. So these are the factors within your work environment. I'm not saying every factor will cause a work-related illnesses, but there needs to be this threshold in terms of duration and exposure, excessive amounts. So that's the concept here. Excessive amounts, duration, incorrect working methods or protocols that actually predisposes you as an employee to these factors within your environment. And then, as I said, it's a combined effort. There needs to be communication with your employer about this work-related medical condition. I'm speaking about work-related illnesses, not your other illnesses, and how this work-related illnesses actually affects your work in terms of productivity as well. And it will also highlight to the employer that he might have to investigate this a little bit further. Do my other employees within my particular environment also have these medical conditions that I can maybe assist them with? So that is the broad area of occupational health. It falls under occupational health and safety when one looks at it in terms of the employer or businesses. And it's also important that I empower you, the viewer, about these work-related medical conditions so that one can actually identify the cause and corrective action can be taken. Because if it progresses, if these medical conditions progresses, at the end of the day, it can impact on you so much that you might not have a job at the end of the day. So the earlier you become involved in the concept, or the earlier you identify that your medical condition is related to related to your work environment, it's actually better for you, because you are able to still take corrective action in terms of preventing this from becoming chronic. So that actually puts you, the viewer, into a better perspective regarding hazards within your work environment. If you're exposed to it, in terms of excessive exposure or incorrect working habits, or not wearing your personal protective equipment, this predisposes you as an employee to develop various work-related health issues. Going forward in terms of this particular show, the Health Notebook, we're planning on actually broadening the scope of the show. So during the course of next year, we'll be looking at phoning sessions. We'll be trying to develop community-based health programs where I would encourage you, the viewer, to become involved in some of these programs. And I want this engagement actually with the viewer. I'd also like to hear your thoughts and suggestions as well. There is an SMS line. And we would also be broadening the scope of this program. So what I mean by broadening the scope is it's not only going to be healthcare practitioners or medical practitioners, but we're going to be trying to get in other healthcare disciplines, for example, dietitians, the occupational therapists, the physiotherapist as well, a speech therapist as well, an audiologist, to give you, the viewer, the full color spectrum of healthcare. That brings us to the end of the show. I hope you enjoyed it. I hope I was able to empower you, or just sow the seed of work-related health illness. It's a fairly broad topic, and just to cover that particular topic in 20 minutes, it's a very short period of time. But this is a new area of medicine. As I said, it's the work-related health issues, and these issues can be addressed if you actually take early action and you actually prevent these medical conditions from progressing further, as this impacts your livelihood. So thank you very much for watching. Stay tuned for another episode, same time, same place, next week.